Hello and welcome to the Highlights podcast summarizing the messages of our first Scleroderma Forum uh, webinar. We we couldn't have a better start. We discussed the role on the MDT, and I was honored to be joined by three very expert speakers, I have to say, after I heard them. They really told us different aspects of why it's important to work together, and they highlighted their expertise. I was joined by Liz Volkmann, the director of the Scleroderma program, the CDILD at UCLA, by Elisabetta Renzoni, UCL, and Royal Brompton, that is specialist in lung disease, not any lung disease, but CTD-ILD, and by Jean Scope, who received a job offer at the end of her talk. She's our specialist nurse that is dealing with the scleroderma, with all the MDTs that we do, because then all the patients end up in Jean's hands. So thank you again, guys, for joining this. I think it's very good for the Scleroderma Forum and for the Scleroderma community. Why don't you give it highlight a Peel, your take-home message from your talk and from what you got from the webinar? I will start with Liz Volkmann.
Great. Thank you again for inviting me to be a part of this wonderful webinar. I highlighted how a rheumatologist can, first of all, play a critical role in diagnosing systemic sclerosis and recognizing the early signs of this disease, because I think the start of the MDT is getting the diagnosis correct. And as a rheumatologist, you play a pivotal role in this area. And then we transitioned to talking about really creating personalized MDTs for your patients based on the manifestations that are affecting the individual patient. And how you can do this not only at an academic center where you might meet in an official meeting every week, but where you might call a specialist on the phone, have a Zoom meeting, and really facilitate a discussion with individual people.
Thank you so much, Liz. Yes, we call it MDT, and it's really our responsibility to call it. And because at the end, we have to engage with the different specialists, first to have the humbleness to engage with the different specialists, and then to make it happen. So thank you. You're right. It's we do have a central role, and that comes with an honor and with a burden. So we should do it. And Elisabetta, so thank you for joining again. So why don't you tell us the take-home message of your talk and what you learned from the webinar?
Thank you, Francesco. And for me too, it was really a pleasure to participate in this webinar. I think from a lung perspective, being a pulmonologist, an MDT can help in a number of ways. One is to determine the severity of the ILD. We spoke a lot about potential contributions of different systems that could also affect symptoms of breathlessness and lung function impairment, including, for example, in scleroderma, skin involvement, the diffuse skin involvement, and others. And then, of course, in an MDT, discussing about management in a disease which affects the lungs, but also affects can potentially affect almost any other organ, the importance of getting together between pulmonologists and rheumatologists to reach an agreement as to the best treatment. Not only first line, but also perhaps the most difficult when patients are progressing despite treatment. What are the options that are best for the patient, both for the lungs and outside the lungs? And in terms of what I learned from the other two fantastic speakers, as Elizabeth was saying, the importance of very early diagnosis and how one can distinguish between a Raynaud's that is very unlikely to lead to disease and another that will need close follow-up. And from Jean's fantastic talk, the role of the specialist nurse and how so central it is. You actually had the specialist nurse at the center of everything, pulling together all the different specialties depending on what the patient needs, and how important that is also to our patients.
Yeah, thank you. I think you're right. That was a theme for our discussion too. Jean, so why don't you tell everybody that needs to decide whether to download this 1 hour and tune in, why they should do that, what's there to learn, and then if what do you think is the take-home message?
So much to learn. It was really valuable for me to be on the call. So from Liz's talk about the rheumatologist role, it was interesting to hear what are the signs that suggest that patients are going to progress to more severe disease, to full systemic sclerosis from the Raynaud's, as Elisabetta said, but also what are the biomarkers that are going to indicate what kind of manifestations they might have of their disease? And you suggested at one point that it was a useful place to take a screenshot, and I definitely did that because that's really helpful. Partly just from my knowledge, but also partly so that we can talk to our patients about you've had this diagnosis, but what does that mean for you? What is your disease likely to look like in the future? And therefore, what medications are you likely to need? What specialists are you likely to see? And I talked a little bit about educating patients at the beginning of my talk as well. We also talked about medication management and how to help patients and support them with tolerating difficult medications and addressing their concerns about medications, whether those are very serious concerns about nausea and weight loss, or whether they're just how on earth am I going to get that many blood tests done? How will I find time in my life? On that note, we talked about the psychosocial burden of systemic sclerosis, how much it can involve that isn't visible on the surface for employers or relatives, but is perhaps causing a storm of emotions, and how we can support patients with that. And then finally about the specific roles that nurses and other allied health professionals like podiatrists can perform in terms of the skincare and digital ulcer management. And I think Elisabetta mentioned that her team in Royal Brompton have done a study involving a dietitian and the input of a dietitian, and I wanted to talk a bit more about how nurses can help with the GI involvement, but a specialist dietitian would just be the cherry on the top. So that was great.
Thank you, Jean. So yeah, you heard it. There was enthusiasm. There was a lot of things to learn. Come tune in, and if you have questions after you have heard the webinar, feel free to interact on the portal. Yeah, you can send messages, send questions. We'll try to answer. And if you think there's things that we should discuss, please, by all means, do write it, because we are here for you. We're here to bring scleroderma knowledge to people that maybe deal with scleroderma not so often. Just what you need, just what you think is useful. So your feedback is crucial. Tune in and come and give a suggestion for next. Thank you, guys.